Welcome, everyone. You're watching Coronavirus in Context. How does this pandemic end? Well, I think I have someone to talk to today who has the answers. Dr. Eliadashi is professor of medical science at Brown University and the author of a commentary recently in JAMA, Potential COVID-19 Endgame Scenarios, Eradication, Elimination, Cohabitation, or Conflagration. Dr. Adashi, thanks for joining me today.
My distinct pleasure. Good to meet you, John.
You know, it's what's on everyone's mind. How does this end? And I think the Delta variant has changed some of our thinking about it. So let's walk through, if we can, each of these scenarios.
Well, eradication is, of course, the ideal option, shall we say, that all of us would embrace wholeheartedly. And it refers to the outright elimination of the virus from the face of the earth. And we've done this before, as you probably know, for smallpox, for example.
Took a long time to do that, though.
Took a long time, yes. And we are mighty near, but not quite there, with polio, which
Sure.
Of course has also been with us now well over 50 years. There are a few pockets in Asia that have yet to be eradicated, but there has been a persistent and consistent effort to accomplish this, and we're very close. So in theory, it is accomplishable, but whether or not this will be the circumstance here is clearly too early to even imagine or daydream about.
And many areas of the world are in the single digits in terms of vaccination. As you point out, eradication is a global strategy. And as you and I know, in many ways, there's vaccine nationalism. That's going to be hard to overcome as we think through an eradication strategy. Well, then let's talk about what's an elimination strategy. And do you think that's possible given what's been going on in the last few weeks?
So elimination is a less aspirational goal, or a lesser aspirational goal than eradication, because it does not aim to eliminate the virus from the face of the earth. Instead, it seeks to selectively eliminate the virus from specific regions, nations, continents, but certainly not in a way that would allow us to say, this is now behind us.
But as you point out, it's not complete removal of the virus from the world.
I mean, we probably cannot even at this point in the history of this pandemic claim, shall we say, full-fledged or 100% elimination. But examples of circumstances where one is close would be Israel, for example, wherein vaccination rates are probably the highest they are anywhere at this time. In fact, as you know, they're moving now to administer boosters to individuals over 60 and who are immunocompromised. So it's a developed nation with 7 million citizens, which is mightily different than a developed nation with 330 million citizens.
Absolutely. Mm-hmm.
And while I'm not sure that Israel is free of the nationalism that you alluded to earlier, or the anti-vax sentiments that are clearly very strong here, they have been able to accomplish impressive numbers. Mm-hmm. And there are a few other examples that I think are aspiring to that. And in the final analysis, all of us want to get there.
Sure. But do you think we'll get there, Dr. Adashi, or are we going to have a cohabitation strategy, which means somehow it becomes endemic. We figure out a way to live with the virus. That's what some people are saying now. Let's stop focusing on every single case and focus on how do we manage it? How do we minimize death in severe cases?
Right. Yes, I agree with you that cohabitation is the most likely realistic scenario in the near future.
What's
We are
near
in a,
future? What's near? That's what everyone wants to know. What's the near future?
we're still talking years, John. I don't think we're talking months. Just look at the vaccination rate in the United States, for example. We've got a long way to go.
Yeah. Did you feel differently, say, 2 months ago when there seemed to be more light at the end of the tunnel? Has the Delta variant changed your perspective in terms of what the end game is?
Well, it did, but you realize, John, that this paper was submitted probably 4 or 5 months ago. And so
You were prescient in terms of what was going on.
I was simply uncertain as to the outcome, and nobody, even though I know many people who are in the know, I never really received a fully satisfactory explanation of what the near-term or long-term future might be. So that's when I recruited this mini team of ours, and we tried to think through the scenarios. And one of the goals we were hoping to accomplish is to give everybody else a framework to work with so that we all speak the same language in a way.
Let's talk about that last one, conflagration, which, sometimes means battle, fighting. It means different, nuances to folks. What do you mean by it in the setting of COVID-19?
Well, it's effectively a state of war between us and what I would characterize is an equal opportunity assassin that is out there to serve itself, survive, and thrive at our expense. It's really
That's different than cohabitation because we're not
absolutely.
having these, frequent episodes or epicenters where
No, this
people
is
are
an all-out war
dying.
that claims more victims, as you know, than conventional wars. And I perhaps will use this opportunity, if you will allow me, to say two more things. One is, as bad as the Delta variant may be, the notion of a so-called doomsday variant should still be on our mind because the virus is evolutionarily evolving all the time. And the more living space we allow it, the more likely it is to take advantage of its mutational ability. What I would say could be a game changer, and I'm sure you have thought about it, is the one ingredient that is still missing in the total mix, and that is a therapeutic. It would introduce a measure of confidence that the vaccines cannot provide at this point because of the anti-vaccine sentiment, because of the nationalism, etc. But just imagine there was an effective therapeutic that your primary care provider could call into the pharmacy. You would take it, and in a matter of days, you'll be back to normal, and you certainly avoid hospitalization, let alone an ICU.
Well, I wanted to ask you that. That was actually going to be my next question. Where is the optimism, Dr. Hadashi? And your optimism may be, it sounds like, in the role of therapeutics, because in drugs,
I think so.
because people typically aren't as anti-therapeutics. No one's saying, don't give me monoclonal antibodies, don't give me remdesivir, even though we're going to continue to have new therapies and additional therapies and really a 360-degree strategy, including more testing and more frequent testing.
This must be a truly difficult problem, or we haven't thrown at it enough financial or intellectual resources, or both.
Well, Dr. Adachi, I want to thank you for your thought leadership on this issue and really creating the dialogue about what is our end game, because that's what we all want to know.
Absolutely. Thank you very much.